You know that feeling when you're facing something huge, like healthcare, and someone hands you a map, but, well, it feels like it's in another language.
Yeah, it can feel really complex, almost overwhelming sometimes.
Totally. Like, what actually guarantees quality care? How do hospitals even get judged on that? And then how do you figure out the plan they give you?
Those are the big questions, aren't they?
Exactly. So today we're doing a deep dive. We've got source material that sort of pulls back the curtain on this stuff.
Mm.
We're looking at info from the big players setting standards, Joint Commission International, that's global, and NABH in India.
Right, the accreditation bodies.
And also from a consultancy, Supreme Medic, that actually, helps hospitals do this stuff, meet the standards.
The practical side.
Yeah. And crucially, we're pulling out tips from their materials about understanding your own healthcare roadmap, your treatment plan.
Which is so fundamental for patients.
Our mission here is basically to connect these dots for you, get those key insights, the aha moments, so you feel a bit less lost and more in the driver's seat with your health.
Spowered, yeah.
Okay, let's unpack this.
So maybe the best place to start is with those foundations, the accreditation bodies. They're really at the heart of setting the bar for quality and safety.
Setting the bar. How?
Well, they create these really rigorous standards and processes to evaluate healthcare organizations. Hospitals choose to go through this. It's usually voluntary.
So they're basically signing up for a tough inspection.
Pretty much, yeah. To prove they're meeting high standards, our sources mention two big ones.
Right. You mentioned JCI, Joint Commission International. The source calls them a global leader. That sounds significant.
It really is. Their stated mission is to enable and affirm the highest standards of healthcare quality and patient safety for all. And they operate, believe it or not, in over 70 countries.
70. Wow.
Yeah, drawing on hundreds of experts worldwide. And it's not just theory. They have practical tools, specific programs.
Like those international patient safety goals the source mentioned. What are those exactly?
Think of them as the absolute must-dos. Universal goals like making sure surgeries are safe, improving how staff communicate, preventing infections, things any accredited place has to focus on.
Okay, so core safety practices.
Exactly. And JCI accredits different places too, not just hospitals, but academic medical centers, specific programs, even newer areas like telehealth and sustainability in healthcare.
So they're adapting the standards.
Right. And they offer training tools. One mentioned is tracers with AMP. It helps staff kind of follow a patient's journey through the system to spot potential problems.
So it's not just a checklist. It's about observing the actual process.
Precisely. It's dynamic. And the sources include quotes from hospital leaders saying this whole process. It builds teamwork. It improves communication.
So internal benefits, too.
Yeah, and it gives them a competitive edge, builds community trust. People feel more confident going there. It helps create a real culture of safety, better risk management.
Okay, that's the global picture. What about nationally? Our sources talk about NABH in India.
Right, the National Accreditation Board for Hospitals and Healthcare Providers. It functions in a similar way, but, focused within India.
Set up by the Quality Council of India.
Correct. Specifically to establish accreditation for healthcare organizations there. The idea is to meet patient needs, the consumers, and set benchmarks for the whole industry to improve. They've got functional autonomy, which is important.
And they offer resources, something called Quality Set2.
Yeah, it sounds like an information portal for searches, questions, FAQs. And it's interesting, they link to iSQA.
Which the source suggests is another key international quality body.
Yes, exactly. So you see these layers, global standards, national standards, all pushing towards what JCI calls a future of zero harm.
Zero harm. That's ambitious.
It is. But these bodies provide the frameworks, the standards, the inspection processes that hospitals use to measure themselves. Ultimately, it's about your safety and the quality of care you receive.
Okay, so we have these high standards, global and national. But like you said, putting them into practice in a busy hospital, that's the challenge.
Absolutely. Standards are one thing, implementation is another.
And the sources mentioned this is where consultancies often come in.
Right. The material uses Supreme Medic Consultancy as an example, describes them as a trusted partner for hospital owners, helping them through, well, everything, from planning to accreditation.
And not just for the giant hospitals?
No, they mentioned working with all sorts, small, medium, large, nursing homes, multi-specialty places, diagnostic centers, too.
What kind of help did they actually offer? The list looked pretty long.
It's comprehensive. It starts right at the beginning, hospital planning and design, which sounds basic, but the layout itself affects safety and workflow.
True.
Then there's direct help with NABH implementation, recruiting staff doctors, nurses planning the workforce, setting up quality management systems.
Okay, the operational stuff.
Yeah, and even really technical things. Calibrating medical equipment, setting up modular operating theaters, medical gas pipelines.
Wait, modular OTs, gas pipelines. Why are those specifically important for, like, quality standards?
Good question. So a modular OT, it's a highly controlled environment, crucial for preventing surgical infections. A properly set up gas pipeline that ensures oxygen and other vital gases are delivered reliably. Life support, basically.
Okay, critical infrastructure.
Exactly. And equipment calibration means the machines giving diagnoses or treatments are accurate. Accreditation standards look closely at all this stuff. The consultancy helps make sure it meets those strict rules.
Makes sense. It's complex. The sources even mentioned an investment model they use, taking equity.
Yeah, positioning themselves as a kind of single-point provider for people investing in healthcare. It highlights the blend of business and clinical knowledge needed.
And they mentioned specific expertise, like Dr. Surta Ram Vishnoi, MBA, former ISWA fellow. That combination seems key.
Definitely. Expertise in hospital strategy and quality.
Oh.
So if you connect this back, these consultancies are like the translators and the facilitators.
Translators.
Yeah, they take the complex rules from JCI or NABH and turn them into practical, often very technical steps for the hospital. They're a key part of that whole ecosystem working towards better, safer care where you might go.
Okay, system view. Standard setters, then the helpers, the consultancies. Let's bring it right down to the individual now, to you, the listener. How does this behind-the-scenes focus on quality actually impact your personal experience?
Right. And one really direct connection highlighted in the Supreme Medic material is understanding your treatment plan.
Your personal roadmap.
Exactly. The sources call it your roadmap to recovery or disease management. It's not just a prescription slip. It's the whole plan. All the steps needed for your specific condition.
And why is understanding it so vital? The material seemed really strong on this.
Because it's fundamental to being educated about your own health.
Yeah.
It empowers you, moves you from just, receiving care to being an active partner in it.
And the source says if you understand it, you're more likely to follow it.
Precisely. Which means it's more likely to actually work. Plus, understanding can really cut down on anxiety, improve talks with your doctor, and just prepare you for what's ahead.
Okay, so what should be in this roadmap? What does a good treatment plan include, according to the sources?
Well, the basics. Your diagnosis, or what they suspect it is, the medications, tests, procedures they recommend, and crucially, why.
The why is important.
Very. Also, any lifestyle changes, diet, rest, activity, your follow-up schedule, potential side effects or problems to watch out for.
Prognosis, too, like the expected outcome.
Yes, prognosis, the likely course, outcomes, possible complications, and importantly, cost. Likely costs, insurance coverage, what you might pay out of pocket.
Cost is huge, yeah. Often a barrier if it's not clear.
Absolutely. So that's what should be in it. But how do you actually understand it all, especially if you're feeling unwell or stressed?
Right. The sources had tips for that. How to understand your plan better. First one seems simple. Listen carefully. Take notes.
Sounds basic, but it's powerful. Write down the condition name, meds dosage, timing why tests are needed, what to do if things get worse. Just having it written down helps.
And asking questions. They even listed 5 key ones.
Yes. These are great. 1, what exactly is my diagnosis? 2, why are these medicines or tests needed? 3, what side effects or risks should I know?
Okay.
4, what are the alternatives, if any? And 5, what happens if I do nothing?
That last one feels really important, understanding the consequences of inaction.
It really clarifies the necessity, doesn't it?
Yeah.
They also suggest asking for written instructions, a summary, maybe clear notes on prescriptions, even digital copies of results, something you can look back at later.
Good idea. And knowing the follow-up plan.
Essential. When to come back, how, if tests need repeating, if you need a specialist. And keeping a simple health log, just a notebook or an app to track meds, symptoms, appointments, makes those follow-ups much more effective.
The sources also had warnings, right? Mistakes to avoid.
Yeah, common pitfalls like stopping treatment early just because you feel a bit better.
Guilty. I think many people do that.
It's tempting. Also, relying only on Dr. Google instead of talking to your actual doctor.
Right. Verify online info.
Absolutely. And crucially, tell your doctor about everything else you're taking, other meds, supplements. And keep them updated if you have side effects or things change. Communication is key.
And there is specific advice for long-term conditions.
Yeah, for chronic stuff. Ask out the long-term goals of the treatment, understand when meds might need adjusting, or when you need to seek urgent care. Know what an emergency looks like for your condition.
It really comes down to being informed and engaged, doesn't it? The system can have all the standards, but your personal care quality depends a lot on your involvement.
It really points to that shift we're seeing, or maybe need to see more of, away from the doctor just telling you what to do, towards a real partnership.
A partnership.
Yeah, the source explicitly calls the treatment plan a partnership between the doctor and the patient. Your understanding, your questions, your adherence, it's all part of making the plan succeed.
So we've gone from those big, sometimes invisible, global and national standards from bodies like JCI and NABH, seen how consultancies help bring those standards to life in hospitals, sometimes down to the pipes and the walls,
Right down to the practical details.
and landed right back with you, the patient, and the power you have when you truly understand your personal health roadmap, your treatment plan.
And understanding all those layers, from the accreditors to your own plan, hopefully makes the whole system feel a bit less like a confusing map.
Yeah, maybe more navigable. It helps you ask better questions, feel more confident, more in control.
Absolutely. Which leads to a final thought, maybe.
Go for it.
If we agree that patient empowerment, through really understanding these treatment plans, is so critical for good outcomes, how do we get better at it?
Yeah.
How can healthcare systems, maybe using technology, make this partnership truly easy and accessible for every single patient, no matter their background or how comfortable they are with medical info?
That's a huge question.
Yeah.
Making that partnership truly seamless and universal, a big challenge. Definitely something to think about.
Indeed.
Okay, that's all the time we have for this deep dive.